Bismillahirrahmanirrahim. My name is Dr. Taimia Ayub, and today I will be presenting the topic of Mpox or monkeypox under the kind supervision of Professor Dr. Saira Afzal, Institute of Public Health, Lahore. So we will start with quote of the day: "Keep your face always towards the sunshine, and shadows will fall behind you." So this is the content outline of today's lecture. We will start with the background and then global and national burden of the monkeypox, followed by epidemiological triad, transmission, signs and symptoms, diagnosis, treatment, recent advances, and at the end we will do multiple choice questions. These are the learning outcomes of today's lecture. So, we will start with the introduction. Mpox, formerly known as monkeypox, is a viral zoonotic disease caused by Mpox virus, which is orthopox virus, which belongs to orthopox virus genus. Once limited to the parts of Central and West Africa, Mpox became a global public health concern after multi-country outbreak since 2022. Transmission occurs through close physical contact, contact with lesions, body fluid, contaminated materials, etc. Mpox underscores key public health challenges related to emerging infections, global mobility, surveillance, and outbreak preparedness, as highlighted by the World Health Organization. This is the timeline for Mpox disease. It started with 1958 when a pox-like disease occurred in colonies of monkeys kept for research in Denmark. Then in 1970, the first human case of Mpox was recorded in Democratic Republic of Congo. In 2022, cases of Mpox were rare and usually linked to travel or to animals being imported from regions where Mpox is endemic. Then in 2022, unprecedented global outbreak began in May. WHO declared Mpox a global health emergency of international concern on 23rd July 2022. In 2023, the first ever case of Mpox in Pakistan was reported to WHO on 20th April 2023. And again in 2024, WHO Director General declared Mpox a public health emergency of international concern for the second time in 2 years. So, these are the confirmed and probable Mpox cases and deaths at a global level to show you the global burden of the Mpox as a disease. So, starting from here, 2022, total cases were around 84,900 and from 108 countries. And total deaths were 138, which decreased to 9,000 cases and 45 deaths in 2023. And again, they are on the rise with 26,000 total cases and 78 deaths in 2024. And finally, in 2025, till now, 50,000 cases have been reported from 96 countries in the world with 206 deaths. So, in August 2024, an emergency committee was convened under the International Health Regulations to evaluate the upsurge of Mpox in the Democratic Republic of Congo and other countries in Africa. On August 14, 2024, the emergency committee met and advised that the situation constitute a public health emergency of international concern. So this is the latest situation of Mpox as of 30th November 2025. This is taken from the World Health Organization website. As you can see on the left side, the cases from outside of the Africa are being shown, and on the right side, cases inside the Africa are being shown. So on the left side, you can see there are multiple small bars of different colors, which shows the region from which the case has been reported. And most of the cases have been from the region of Americas, European region, and the Western Pacific region. As you can see, we cannot see any yellow color, which will represent the uh, Southeast Asia region, or the purple color, which represents the EMRO region of WHO. So, and on the right side, you can see the bars are quite high and they are representing the African region. And you can see the maximum bar was in May when the cases increased above 6,000. So, let's move forward. And you can see this is total Mpox cases in the past 12 months from 30th November 2024 to 30th November 2025. And as you can see in this map, Pakistan and India and a few other countries in the South Asia, they are in the green region, which are showing the total cases from 10 to 99 cases. And the darkest color is in the heart of Africa, and this is the Democratic Republic of Congo, where 10,000 plus cases were reported. Even China has reported 1,000 to 9,000 cases, and similarly, USA also has darker color. So, this is the current situation in the past 12 months. These are few glimpses of Mpox in Democratic Republic of Congo. In both pictures, children are being the most affected. So, Mpox in Pakistan. Cases reported in 2025. Pakistan has reported multiple Mpox cases in 2025, including a first case detected at Peshawar airport in January 2025 in a traveler returning from Dubai. A second 2025 case is reported in Sindh. A 28-year-old man in Hyderabad with recent travel history from Dubai. These cases reflect imported infections linked to international travel, primarily from the Gulf state. Local transmission 2024 to 25. Pakistan has previously recorded local transmitted Mpox cases, notably in Peshawar, where one case did not have recent travel history and was classified as locally transmitted. So, for Pakistan particularly, the mode of transmission is majority imported, travel related. At least one locally transmitted case reported previously. Deaths only 0 to 1 reported deaths, very low mortality, and overall status is that for Pakistan, it is a low case burden and no large scale community outbreak to date. So, the World Health Organization renamed the disease from monkeypox to Mpox in November 2022 to follow World Health Organization best practices for the name of new human infectious races. New infectious diseases. Those guidelines should recommend that disease names should avoid offending cultural, social, national, region, professional, or ethnic groups and minimize unnecessary negative effects on trade, travel, tourism, or animal welfare. So, epidemiological triad of Mpox, you can see we have the agent, which is the Mpox virus, then the host, who are the humans, and then environment. So, we will deal with these one by one. So, who is the agent? Is the Mpox virus. Mpox is a zoonotic viral illness caused by the monkeypox virus, MPXV. It is an enveloped double-stranded DNA virus of the orthopox virus genus in Poxviridae family, which includes variola, cowpox, vaccinia, and other viruses. This is a comparison of the Mpox as compared with other viruses. On the left side, we have the Mpox virus, which is very large in size as compared to the even HIV, especially the polio virus, which is on the extreme right side. Types of Mpox virus. We have clade 1 with subclades 1A and 1B, and similarly, we have clade 2 with subclades 2A and 2B. So, for clade 1, it is responsible for the current rise of cases in Central and Eastern Africa. Historically, Clade 1 causes highest number of severe illnesses than Clade 2, with up to 10% of the people dying from it. Recent outbreaks have seen much lower death rates of about 1 to 3.3%. Clad with subclads 2A and 2B, Clad 2 is endemic to West Africa. In 2022 to 2023, a global outbreak of Mpox was caused by the Clad 2B strain. Infections for Clad 2 Mpox are less severe. More than 99.9% of the people survive. So countries known to be endemic from Clade 1 and Clade 2 Mpox. So for Clade 1, it is shown in bluish purple color, which are the Central African countries. We have Democratic Republic of Congo, Gabon, and Central African Republic. Cameroon, as you can see, has both the colors of purple and green, as it has both Clade 1 and Clade 2. And then for Clade 2 in green color, we have Nigeria, Ghana, Liberia, and Sierra Leone. Host factors, animal host, such as African rodents, Mice, prairie dogs, and non-human primates play important role in development and transmission of outbreaks. In humans, close or intimate in-person contact with individuals who have suspected or confirmed Mpox or are a part of social network or community experiencing Mpox. For example, communities in Democratic Republic of Congo are more at risk. Recent travel to Central or West Africa or other parts where large outbreaks of Mpox have been reported. Risk of disease is severe in children, pregnant women, people with weak immune systems, including people living with HIV that is not well controlled. Then we come to environmental factors. We have factors like cases are directly associated with heat index. A study showed that for each 1 degree rise in heat index, daily cases increased by 7.7%. Similarly, we have higher relative humidity and wind speed were associated with decreased daily cases. And then Mpox transmission through wastewater, air, and contaminated surfaces is a significant concern, and its detection and destroying will play a major role in controlling the spread of disease. Pox viruses have a high environmental stability but are sensitive to all common chemical disinfectants. Transmission of Mpox. Animal to human transmission of Mpox occurs from infected animals to human from bites or scratches or during activities such as hunting, skinning, trapping, cooking, playing with caresses or eating animals. The animal reservoir of Mpox virus remains unknown and further studies are underway. People can also contract Mpox from contaminated objects such as clothing or linen through needle injuries in healthcare or in community settings such as tattoo parlors. Then we have human to human transmission, direct contact with rashes, scabs, or body fluid of a person with Mpox, close face to face contact, intimate activities, and sexual contact. The virus may spread through respiratory particles such as from coughing or sneezing. Vertical transmission. A pregnant woman who gets Mpox can pass the virus to the unborn baby. Contracting Mpox during pregnancy can be dangerous for the fetus or newborn infant and can lead to loss of pregnancy, stillbirth, death of the newborn, or complication for the parent. This is the different cycle as we have explained before: animal to animal transmission, animal to human transmission, and human to human transmission. Phases of Mpox disease. The incubation period of human Mpox can range from 5 to 21 days, with typical incubation period of 7 to 17 days. Incubation period is followed by prodromal period of 1 to 4 days. In this phase, there is usually fever and body aches. This is followed by a second active phase, which typically occurs after the fever subsides and with the appearance of skin or mucosal rash, which might include a single or multiple lesion. So the signs and symptoms: the mpox rash often begins on the face and spreads over the body, extended to the palms of the hands and soles of the feet. It could also start on other parts of the body where contact was made, such as genitals. It starts as a flat sore, which develops into a blister filled with liquid that may be itchy or painful. As the rash heals, the lesion dry up and crust overs and fall off. These are the stages of the mpox rash. This is taken from the CDC website. As you can see, it starts with the stage 1 of macule. Then we have stage 2 of papule, which lasts for 2 days. Then we have vesicle, pustules, and finally scabs, which takes about 77 to 14 days to fall off. Other signs and symptoms may include rash, which is the most common, fever, chills, sore throat, swollen lymph nodes, for example, maxillary, cervical, or inguinal lymph nodes, headache, muscle aches, back pain, and low energy levels. Complications of Mpox include skin can become infected with bacteria leading to abscesses or serious skin damage, pneumonia, corneal infection with loss of vision, pain or difficulty in swallowing, vomiting, and diarrhea, encephalitis, sepsis, myocarditis, proctitis, or urethritis, and it can be fatal in some cases. This is again the process of being exposed to the incubation period, then prodromal phase, and then different target organs. So, diagnosis of Mpox. Identifying Mpox can be difficult because other infections and conditions can look similar. It is important to distinguish Mpox from chickenpox, measles, bacterial skin infections, scabies, herpes, syphilis, other sexually transmitted infections, and medication associated allergies. The preferred laboratory test for Mpox is detection of viral DNA by a polymerase chain reaction (PCR). The best diagnostic specimens are taken directly from the rash, skin fluids, or crust collected by vigorous swabbing. In the absence of skin lesions, testing can be done using swabs of throat or anus. Testing blood is not recommended. Antibody test detection methods may not be useful as they do not distinguish between different orthopox viruses. According to WHO, to date, there is no effective antiviral treatment for Mpox. The goal of treating Mpox is to take care of the rash, manage pain, and prevent complication. Early and supportive care is important to help manage symptoms and avoid further problems. This is taken again from the World Health Organization WHO site. What is a suspected case? A person with sudden onset of high fever, followed by vesiculopapular rash, predominantly on the face, and present on the palms of the hands and soles of the feet, or presence of at least 5 smallpox-like scars, or any person with fever greater than 38.3 degree 101 degree Fahrenheit, severe headache, lymphadenopathy, back pain, myalgia, and severe weakness, followed by 1 to 3 days later with a progressive rash that often begins on the face, more dense, and then spreads elsewhere on the body, including the soles of the feet and palms of the hand. Then we have confirmed case, any case for which the clinical and epidemiological diagnosis of Mpox has been confirmed, laboratory confirmed. Then we have case management of Mpox, which consists of isolation. Then we have symptomatic treatment, which is primarily supportive, like patient should be given antibiotic, analgesic, and fluids. Then we have antiviral treatment. There is no specific antiviral treatment, but some antiviral medication have been shown efficacy. Then we have infection prevention control, which should be strictly enforced. Contact tracing should be done, and public health reporting of confirmed cases must be reported to the local district and provincial health department. Mpox vaccination. Getting an Mpox vaccine can help prevent infection. Pre-exposure prophylaxis. Similarly, post-exposure prophylaxis should be done. In these cases, the vaccine should be given less than 4 days after contact with someone who has Mpox. So, some of the clinical trials for Mpox treatment have been undergoing. For example, USA approved drugs such as tecovirimat, TPOXX, and similarly other like Vaccinia, Immune Globulin, they are underway. It is a priority to continue evaluation for therapeutics in different clinical trial and to focus on optimizing supportive care for patients. So now we will try to apply the levels of prevention on Mpox. We are similarly have three levels: primary prevention, secondary prevention, and tertiary prevention. So for primary prevention, we have health promotion and specific protection. In health promotion, regarding spread of disease, avoid contact with suspected Mpox patient, covering face with mask, and healthy sexual practices. For specific protection, mainly we have vaccine for pre and post exposure prophylaxis, close contacts of diseased, and healthcare providers taking care of Mpox patient. All these should be vaccinated. For secondary prevention, we have early diagnosis and prompt treatment. The most important is differentiating Mpox from other similar viral diseases and through timely diagnostic tests. And for prompt treatment, mainly we have supportive treatment to avoid complications. For tertiary prevention, we have to manage the complications like encephalitis, sepsis, myocarditis, pneumonia, etc. And then we have rehabilitation facilities like after loss of vision due to corneal infection. For recent updates, Mpox RNA 1769 vaccine inhibits orthopox virus replication at intranasal, intrarectal, and cutaneous sites of inoculation. According to this article, the vaccine prevented viral replication and spread from the disease or from the site of inoculation, even at a very high challenge doses. The level of protection was correlated with the dose of mRNA administered and the resulting neutralizing antibody titers. Passive transfer of immune serum from vaccine non-human primates also confirmed protection, indicating that antibodies played a key role in vaccine efficacy. Then this is another paper from 13th September 2025 from Frontiers in Pharmacology. It is titled Evaluating the Advancement and Efficacies in the Pharmacological Mpox Treatment, a comprehensive review. It states that Mpox became an urgent challenge in infectious disease control without specific antiviral drug and under drug-resistant strain. Existing treatments are mainly antiviral agents repurposed with different levels of effectiveness and safety. Advances in molecular pharmacology, such as host pathway modulator and mRNA vaccine platforms, provide new hope. But fair access, regulatory alignment, and continued R&D investment are crucial. A multifaceted approach of pharmacology, surveillance, and rapid diagnosis is essential to minimize the global mpox burden and for pandemic preparedness. So now we come to the multiple choice questions. So, we have first MCQ. A 34-year-old man presents with fever, fatigue, and painful skin lesions on his face, hands, and genitals following recent travel to an area with an Mpox outbreak and attending a social gathering with close contact. Mpox is confirmed by PCR testing. What is the primary cause of Mpox? It is a fungal infection or allergic reaction, viral infection, or bacterial infection.
C.
Yes.
C.
Yes, it is C. Then we have what type of virus is the Mpox virus classified as? Retrovirus, adenovirus, orthopox virus, or herpes virus?
C.
C.
Yes, it is an orthopox virus. In 2022, a global outbreak of Mpox caused a havoc in the world. Which clade of Mpox caused this outbreak? Clade 1A, 1B, 2A, or 2B?
1A. A.
It was basically 2B, which was global. One is mainly concentrated in African region. So, what was the global situation of Mpox cases since the peak in 2022? Cases have declined since the peak in 2022. Cases have increased significantly. There have been no reported cases since 2022, or the global situation remains unchanged since 2022. What is?
B.
A.
Uh, there were about cases have declined since the peak. The peak was about 80,000 cases. So till now, in 2025, we have not crossed the level of 87,000 cases. There were like about maximum were in 2025 with 50,000 cases. So we have not crossed that peak yet. What is the most common symptom associated with Mpox? Cough and sore throat, rash that evolves through stages, muscle aches and fatigue, or fever and chills.
B.
B.
Yes, it is rash that evolves through all the different stages. What is the significance of the prodromal period in the progression of Mpox? The prodromal period allows for early detection of Mpox. It is characterized by severe complications, or it is when the rash first appears, or it indicates the final stage of the disease.
A.
C.
Yes. What are the stages of the Mpox rash? Macule, papule, vesicle, pustule, macule, papule, vesicle, pustule, or scab, or macule, papule, blister, or pustule, or finally macule, papule, or vesicle.
B.
Yes,
B.
B.
yes, it is B. Scab is the characteristic and stage of the Mpox. Which complication is not commonly associated with Mpox? Rash and skin infections, sepsis, lymphadenopathy, or cancer?
D.
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 Yes, it is cancer. A 29-year-old woman presents with fever, swollen lymph nodes, and a painful rash with vesicular lesions on her hand, arms, and faces, which developed a week after close contact with an infected friend. Mpox disease is suspected. What is the diagnostic test of Mpox? Direct microscopy, detection of viral DNA by PCR, antibody test, growth on culture media.
B.
B.
Yes, PCR is the what antiviral medication has shown efficacy in treating severe cases of Mpox? Tecovirimat or Tpox, remdesivir or saltamivir or acyclovir?
A.
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 Yes, it is Tpox, yes. So this is the answer key, and this is the YouTube channel where it will be uploaded. And thank you very much for watching.
Thank you very much, Dr. Taimia, for a very nice presentation. It is a good activity for the